Here is something which you will recognize instantly as being wrong with the brain. This is a CT scan. You know it's CT because it's the bone that has the increased density rather than the fat or the fluid. And notice there is an irregular nodule near the midline, which has a less of a density in the center. It's almost like it's growing so fast that the central portion may become necrotic and less dense, because this is a very quickly growing brain tumor. This is a very malignant, therefore, brain tumor. It is not a low-grade glioma. This is a glioblastoma multiforme, which is synonymous with the term high-grade glioma. Here's another X-ray. Only in this case, it's an angiogram. You could basically see the cerebral arteries fanning out. You can see the base of the brain here. Here's the carotid, internal carotid making its turn. Here's the area of the circle of Willis. And notice there is an area in which the blood vessels appear to become increased to feed this tumor. Here is a gross picture of the tumor. And in it, we could see that it is fairly poorly differentiated from the surrounding brain tissue, perhaps originating in the midline, also very hemorrhagic because of the increased flow, and perhaps a little yellowisher on the center because it may be necrotic. This may be the area that's dead because it's growing so fast. The central portions no longer have any blood supply, and therefore it's more likely to be a little more liquid, which means it's going to be a little bit more or less dense on CT and perhaps more signals on MRI because there's more water. Here's a microscopic slide from this general area in which you can see perhaps out on the edge here something which I could convince you might be relatively normal brain, or at least brain in which there are an increased number of glial cells. Most of these cells are glial cells. This may be gliosis with respect to the tumor, whereas this cell here is actually a neuron, isn't it? Oh, could we find another neuron? Yeah, probably here. But when you move over to the tumor area, you can see we no longer had differentiation between glial reaction and neurons. We now have a kind of a very, very ugly picture of something that has these abundantly prominent blood vessels. And in addition, the tumor cells, or many of the tumor cells, are arranged almost as kind of like a palisading feature around these blood vessels. Let me see if I can demonstrate that a little bit better. Here's a blood vessel. Here's a necrotic area around a blood vessel. But look how the cellular area seems to be lined up in a row or palisading. And that's because in glioblastomas, one of the features is that there's kind of a palisading, and central to that is a necrotic area. But even more importantly, on a large scale, is that the large central area is necrotic. So if you were to look at this part of the slide from the inside of the tumor, you don't see any cellular outlines at all. This is all dead brain. You must have necrosis of brain in order to diagnose glioblastoma multiforme. It would also be nice to see the palisading that we saw. But just as common and invariably present in glioblastomas as well is something you might guess, and that is big, ugly, nasty cells. They look as malignant as all hell. You don't have to be a rocket scientist to figure out that this cell is as malignant as all hell. Its nucleus is 10 times bigger than any other cell around it. Here's another big, ugly cell. And if you remember when we were looking at the low-grade glioma, we had a hard time finding cells that were a little bit bigger and darker than the rest of them. But look what we have here. we have big, dark, ugly cells all over the place. Let me see if I could find another particularly nasty one. Oh, here's a couple of nasty ones. Let's go to a random area, like here. These are all tumor cells. And here's a couple of big, dark, ugly ones. But let's see if we could find a really nasty one. Notice even on the small blood vessel level, you can see kind of a palisading of tumor cells around the blood vessel. Oh, here's a real big, dark, ugly cell. Here's some that are pretty nasty. And these are features of glioblastoma multiforme, is extreme pleomorphism and hyperchromasia. But the main feature is that you got to have necrosis. Thank you very much.